back to the third episode of my Movember Health Tips series, which addresses the disparities in men's health. Today, I'm going to discuss another health condition that affects 1 in 3 American adults, and a staggering 20% of the people with this condition don't know that they have it. Listen to this statistic. An estimated 1,000 deaths per day in the U.S. are attributed to this condition that is known in medical circles as the silent killer. You probably expect me to say heart disease, cancer, or some other culturally sensitive disease, but hypertension, also known as high blood pressure, is the culprit at the root of these statistics. High blood pressure is so common that we become desensitized to how extremely dangerous and serious a condition it truly is. So my goal today is simply to give you a quick glimpse into the severity of this condition. Blood pressure is the force of blood pushing against the walls of your arteries as your heart pumps blood to the tissues of your body. Like most systems in the body, there is a degree of homeostasis, or balance, that keeps your blood pressure in a certain range based on specific circumstances. Blood pressure will naturally go up in times of stress, fear, or physical exertion to prime your body to move. This fight or flight response is normal, but the introduction of certain lifestyle variables offsets our body's ability to regulate the pressure through specific mechanisms and result in excessively high pressures all the time. Smoking, excessive alcohol intake, poor diet, and physical inactivity are all included in these lifestyle variables. This eventually leads to end-organ compromise and eventually failure, and people find themselves with a chronic illness that drastically lowers quality of life. Here are some statistics that I hope alert you to the dangers of walking around with high blood pressure. You are 4 times more likely to die from a stroke. 77% of people with first-time stroke have high blood pressure. You are 3 times more likely to die from heart disease. 69% of people who have a first heart attack and 74% of people with chronic heart failure have high blood pressure. It's the second leading cause for kidney failure, which at severe stages requires dialysis treatment. High blood pressure is not a joke and shouldn't be taken lightly, but despite the evidence of risk, statistics show that less than half of people with hypertension or high blood pressure actually have it under control. The newest guidelines endorsed by the American Heart Association and several other medical organizations for blood pressures are shown here. If you have values in the hypertensive crisis range, do not wait until you have severe headaches to start being concerned, as I've had patients tell me during specific encounters. That presentation, quite frankly, is too late. All the other organ damage discussed earlier can happen without any noticeable symptoms at all. Please, have a conversation with your doctor about high blood pressure if you're at risk or have discovered for yourself that your numbers are consistently high. And remember, blood pressure is like a roller coaster. It can rise or fall based on multiple factors, so it is important to note a consistent trend versus one single reading. Again, thank you all for your attention and support regarding this serious condition. If you know anyone who might benefit from watching these videos, then please share. Maybe you can help someone you love from dying too young.